Hello. Let's Talk About It Tuesday is back on the air. Hello. Today our topic is going to be about children and their scalp disorder. And I read some of the response and talked to some of the people that had sent some information in to me dealing with the different types that are going on with their scalps and stuff. So I thought about it today would be a great and excellent day to talk about the disorders in children. I am Suzette Robinson, and one of the issues we're going to talk about, I think is most important, is how children are being affected in their scalps by different things. One thing I have noticed that is going on is different fruits and foods that they're eating are causing them, hi Dr. T, is causing them to have different types of scalp disorders and different types of infections that are going on. One thing that came to me early part of the week, last week rather, was a young lady brought a child in. And this was a small child, 18 months to be exact. And she's dealing with alopecia areata. One thing I did notice is that it's very important that we pay close attention to what our children are eating, where they're eating. My granddaughter, I often talk about her. She had a flare-up this week, and it came from eating all of that bread that she loves, and it set up yeast in her body. So her scalp was terribly inflamed. Her lymph nodes behind her ear was swollen extremely bad. So one thing I told my daughter, it's very important to know what your children are eating, because I have not seen so many cases of children having hair loss, and it's not all due to the pulling of the plaits and stuff, but they're having all type of infections in their body that's coming out in their scalp due to eating foods. We found out one thing that children don't need to have is a lot of red juice. The dye in the juice can cause a lot of infections in the body. And so I told one parent that we would look at her daughter's scalp under the scope to look at it to see what the follicles look like or if they're closing. And some of the medication that they prescribed for this young baby, in my opinion, would be too harsh for her to take. But once again, I told her, please take the time to analyze what your children are eating. Now, I know we live in a society now where our children, we're busy. We're some busy people. We're doing a lot. Some of us don't have time to cook or whatever. But let me tell you, when we were growing up, those of you that grew up and your parents cooked for you, we were healthier people because they took time to feed us. And we got to go back to that same way of living. One thing I noticed is that my grandchildren love McDonald's, so they love eating here and there. But because I don't always know what people are cooking with, what they're using, I told my daughter it's best that we start taking care of them at home. Now, one thing I seen from my grandbaby is that her scalp had started cracking open, and there was this oozing of like pus coming out, where the infection was trying its very best to come out. And everywhere it ran, it infected that area. So I was telling her, when that happens, you cannot just take her in and just shampoo her hair with anything that you just buy over the counter, because you don't want to cause it to flare up any worse than what it has already done. So, result of that, she did have to go to the doctor and get some antibiotics. But I want to really say to parents, please, let's be very careful and cautious of hair barrettes that we buy, where we buy them from, you know, because the material that it's made of. I also found out she was allergic to the yarn. I wear the yarn braids. She cannot. The color yarn, she cannot. She's allergic to it. So a lot of things you find out by trial and error, because you don't really know what will happen until it happens. So I'm on this live today from Let's Talk About It Tuesday to let you know that it's very important that we take the time to really know what we're putting on our hair, on our children's hair, because children are really suffering. I'm just so outdone at how so much is happening to their hair because of the products that we use, because of the, even down to, like I said, the barrettes. So you have to be careful. Now, you know, I like to buy a little inexpensive stuff, but you got to be careful of the products that's being used, and you're putting it so close to their scalp and their skin, because they can have allergic reaction. Also, sodas, a lot of acid, and you know, it's hot. Water is sufficient. Water is sufficient. But when I put out the pictures about the hair growth serum that I use in my office, it works well with children. But the only thing about it, I do have to do a consultation to see what's going on with the child before I just really administer it to them, because we want their hair to grow, but we want it to grow correctly, and I don't want to cause any more harm to them. So many of you wrote and talked to me about that hair growth regrowth system, and what I did decide to do, I'm going to be out of town next week with the National Beauty Culture League, and so we'll be filming Let's Talk About It Tuesday from there. But the week after then, I think we're going to do a YouTube where I'm going to do a demonstration on a head that's infected, and to show you exactly how it's used, because I think people really wanted to know exactly how it's used. But I will tell you this, just like anything that you use, you have to follow the manufacturer's directions, because if you don't, you won't get the results that you're looking for. And so it's very important that we follow it from start to finish, using it correctly, the amount of days to get the results that we're looking for. I'm very proud of what's happening with the regrowth system, along with the shampoos and conditioners, the elixirs, and different things. But like I said, anytime you use anybody's product, you want to make sure you understand what's in it, and make sure it's sufficient to use for you, because we all have different things that we're combating. And but one thing I do want to promote is healthy eating, getting proper rest, you know, and doing those things that will cause the body to function in the way it was created to do so. I don't normally get on the live to talk too much about what's in the product, but I will tell you this, it's strictly from the earth. I don't use any synthetic, no synthetic base, because synthetic, the body does not receive it well, but naturally it absorbs it and it begins to work. And so I am really enjoying what's happening. I will have some more pictures that I'm, with the permission of the client, I will be having more pictures to show the results of what's going on, how the beginning, how it looks from the beginning, and what's going on after so many treatments. So you can start seeing, and if it's something that you're needing, or something, or you know somebody who needs their scalp analyzed or whatever, then you can give me a call and we'll set up an appointment to check them out and see if what we have in the office can be sufficient for their need. Hi, Melvina. Once again, we're getting ready for the National Beauty Cultures League, and I'm very excited about that, because it's a week of education, and a week of love where we're going to come together as one big family, learning more about our industry, how to make it better, how to move from one level to the next. And I am so excited. Hi, Terry. Terry is one that, her grandbaby was one that came into the office. And Terry, I was talking to them about the different, about the scalp disorder, and how I'm noticing so many children are being affected by scalp disorders and hair loss. And it's alarming to me because, you know, it's got to be something that we're eating. It's got to be something that we're doing, because, you know, once again, we're always in a hurry. We're always trying to get things done, and you know, we take a lot of shortcuts. But the result of taking shortcuts can be devastating, okay? And so right now, we need to pay more attention. We need to take time to do what is necessary to help our children. You know, because when I look at a little boy, when I was growing up, if a little boy had a spot in his head, you know, we'll say, hey, he just got a ringworm from going to the barbershop. But these disorders are severe. I mean, they're getting in their bloodstreams, and it's really, really, really alarming to me, because, you know, children only can do and have what you allow them to have. So we got to be very careful. I'm going to read what Dr. Cox says. Something that we are not eating enough of. That's true. The right foods. Because you know what? We like French fries. We like chicken. We like a lot of stuff. We do. I do. But, you know, too much of it is not good for you. You know, and a lot of this food is processed foods. A lot of it's not being prepared correctly. But we're eating it. We're digesting it. And it's really alarming. I went to a school one time, and only to see, you know, kids. You know, I'm used to seeing little girls with bows on their hair and looking cute. But these children, hairline are moving further and further back. They got patches. But when I started seeing it, and it's, I mean, the scalp is discolored. You know, there's something terribly wrong. Professionals, we need to get on our game. We need to up our game. It's wonderful to make a person look good, you know, fix their hair, make them look really good. But what's best to do is to learn how to treat the hair and the scalp. Do you know that's our profession? That's what we are supposed to be extremely good at. You know, not just the hair making it look good, but what's going on to keep that scalp looking healthy. You know, a dentist, when he does your teeth, it's not just to make the enamel look good, but he's working on your gums. And if it's a problem with your gums, he may find out that it's something that you're eating. You know, it may be a disorder going on in your stomach. So we have to take professionals the extra mile to learn more and more about what we're doing. And I'm going to tell you about me. I'm going to take that extra mile, and I'm going to put forth an effort to work to the best of my ability to answer these questions that have been asked of me. And you know, I take this serious, and I'm not going to stop what I'm doing. I'm going to continue to do it, and with God's help, I'm going to be very successful at this, because I trust God to give me the knowledge that I don't have, and give me the wherewithal to get all the education that I can possibly get. I thank you all for taking time to come in on the Let's Talk About It Tuesday. And since I'm going to Herndon, Virginia, and we will be at our 100-year celebration, I'll be there with Dr. Cox and Dr. Tara Farrell, and they're certified hair loss practitioners, and we will collaborate and talk about some issues, because we're coming together as professionals to help sharpen what we do, so we can do very well in what we do. I'm going to read what Terry wrote. She said, little girls, yeah, okay, they wore ponytails, curls only for Easter. And that's true, because you know what, and I'm going to tell you, during that time, after Easter was over, baby, my mama put my hair back in a ponytail. But, you know, we try a lot of things that we see on television, and every style is not for every child. So, you know, we may use the flat irons too much. You know, we may put sprays on them, you know, that irritate their skin. We've got to be extremely careful what we're doing. Because it's very important. To me, it's very important. And when I see a child cry because they're losing their hair, that bothers me. Because, you know, they're not responsible for what happened, but they are looking at us for answers. And so we need to get educated so we can give them the answers that they need. And then we need to be educated so we can do better with them. And I love the fact that I do have some people, some parents that are very concerned about their children, and they're willing to learn. They're willing to do whatever it takes to help their child. And so, once again, let's talk about it. We need to talk about it because I need to know, what are your concerns? If you know someone who has a child who's going through, don't wait until the hair is come completely out. If it's coming out, that's the time to get the help. If you notice it's thinning, come on, now is the time. Sometimes we let things go too far. And in my studying, when I was studying about the alopecias that I noticed children are really dealing with, some things could have been combated at when you first noticed it. And when you know, and then some, we just let it, just like anything, just like a car. When that light come on, that means something's going wrong. Go get it checked out then. Well, I'm going to go a couple of more miles. I'm going to do this, I'm going to do that. Well, at some point, when you finally decide to take it, the damage would have already been done. So what I'm saying today, let's not let it get so far out that we can't get the help that we need. And I do like working with the professionals that are willing to work with me. That I don't know everything, but together we can help solve a lot of problems when it comes to our industry. And so I pray that at some point in time we will really learn how to work together and encourage each other and to help each other catapult to the next level. I'm enjoying what I'm doing. I'm going to tell you, continue to watch what is going on. To the P2P Nation, we finna level up. It's time to move up this way. And those that are really putting forth effort to take their business to a whole nother level, I promise you, it's going to take you places that you dream about. And I'm enjoying what's going on. And Tara, I appreciate you for entrusting me with your grandbaby, you know, and we're going to continue to work together, continue to grow as we continue to know. And all that we don't know, we'll get the information. We will get the information. But once again, be cautious of what you're eating. Be cautious of what you're feeding your children. And, you know, even with vitamins, y'all make sure that these are no off-brand vitamins. Don't give them no off-brand anything. You know, take time to do the right thing from the beginning. Because right now, to see another child cry, when my granddaughter was crying in my face, that hurt me. I knew then I got to level up because helping her helps me. And I can't call myself a hair loss practitioner and I'm not practicing what I preach. And so I'm telling you, it's more to this than I even imagined. You know, when I first started this, I thought it was just something that I would be able to do. But I didn't know I had to keep learning and keep learning and keep learning because everyday alopecia is expanding. I mean, it's not just when people tell you and you go get a diagnosis. When you go to the dermatologist, don't just let them tell you you have alopecia. Ask them what kind. Because you can't treat what you don't know. Ask them what kind. Because one thing I'm finding out when they do come to the practitioner and they say, well, hey, I have alopecia. And the first thing we ask, what kind? And if they don't know, then we have to scope it and find out which one they have. Because different ones have different treatments. Some can't be treated. Some is not reversible. And we need to be honest. If it's something, if you come in and it can't be treated where the hair will come back, then we have another alternative, and it's called non-surgical hair replacement. That's when you get your cranial prosthetic, okay? So, thank you, Miss Finch. And so we've got to go the extra mile. Y'all, this epidemic is not going away. It is not going away. But we can learn all there is to know so that we can be a help to those that are in trouble. What good are you if you can't help somebody? And that's my philosophy, and I love what I do. And I love the fact that many of you inbox me and you say some wonderful things to me that encourage me to keep going. That's why I'm going to the National. I graduate this time. Whoop, whoop. I'm so excited and glad about it. But I'm not going to get a degree and just sit on it. I'm going to make it work for me. Okay? And with that being said, I'm going to continue to educate and learn so I can be a blessing to those that are in need, those that are having trouble with their scalp, those that are experiencing thinning, and whatever the case may be. Some I can treat in the facility and some I can't. But what I will do, I will refer you to a physician that can help you. And alongside the physician, we'll work together to get you the results that you need. It has been my pleasure, and let's talk about it. But I want to hear from you too. Send in your questions, your comments, so we can come together and we can talk about it. And we can get results that you need. If you know somebody that's experiencing hair loss or thinning, please put them in contact with us. And when I say us, it's more than me, because I have others that know how to do just what I'm doing, and we can help together. We're strong together, and I'm grateful and very thankful. I've got to get off this live because I'm in my car. And I got caught between here and going to getting ready for another client. So I didn't want to not come on today and talk to you. But so I appreciate your time. And those of you that's interested in any of the products that that I have, please inbox me. Forthcoming, I will have it online. It's going to be on the website where you can see the product, and I will have descriptions of what it does. And if you're interested, then I can get it to you. Okay. And so I'm trying to think, is there anything else I need to tell you? You're absolutely right. Now Terry I'm glad you said that, Terry, because I talk with her, and sometimes you can't go to a dermatologist and they will tell you just generally, hey, it's alopecia. We're going to give you this, this, and this. But again, I say, if you don't know what type, it's going to be pretty hard. It's going to be pretty hard to get to the root of the problem if you don't know. So yes, sometimes you have to go get a second opinion. And many people don't know that hair loss practitioners even exist. We do. We exist, and we need to sound the alarm to let people know we're here so that we can help you with the things that you need. Now, our profession, let me explain this. A dermatologist is certified to work with the skin and the scalp, okay? They can't work with your skin and scalp. But a practitioner, we work with your scalp, your hair, and we take a deepening into the hair to find out what we can do to help, because that's our profession actually. I mean, they do surface, we go beneath, we go in. And that's why I encourage those that's been certified, carrying that certification, take it to another level. You'll never know everything. Continue to learn. Continue to understand. I mean, because if you stop at just getting your certification, you can't go any further. But if you continue, you can get some results. Those pictures that you all had seen on the Facebook page, they're real clients. They're real clients. And I don't usually put any of their pictures like that out there, but I got permission from them this time because they were so proud. And I'm going to tell you something. I had one lady to tell me, Suzette, if I don't care if I don't get a long head of hair, if I can just get a little fro, if I can just see some growth, I'll be happy. See, people are looking for answers. That's why it's important that we can't, this ain't something we play with. But when it comes to children, that's dear to my heart. Because, you know, I'm always looking to see, why so many people don't have hair? How come their hairline movement? A lot of questions are in my head. But I'm going to tell you about me. If the question comes up, I've got to find the answer. So, P2P Institute, P2P Certification and Training Institute is the place where cosmetologists can learn and expand from behind the chair on how to combat and help with hair. Okay, so that's always offered for the cosmetologists. And also, I think that I'm gonna put together something for the parents and my clients that come in to help educate them about different types of things that they can do at home to help when they see that their hair is thinning or, you know, the texture's changing. We need to be educated. So my job is to make sure we get educated. And I am so thanking you all. Take this and share with your friends and family. Let them know that Let's Talk About It is going to talk about it. So continue to reach out. I do read your posts. I do read the ones that you inbox to me. And I do have a few more people I got to call on that list, and I'm going to call them because next week I will be out of town in Herndon, Virginia. And there I'll be getting more education. So I'm excited about that. And the next week, I think we have a guest that's going to be on our live. And I'm not going to spill the beans on that, but we do have a guest coming. Once again, I could be reached at P2P information 7 at gmail.com. You can also go on my website, which is wigsbysuzette.org. And I have a second website that's coming out, and I will let you know about it in about a week or so. Also, you can go on to our YouTube, which is being filmed right now. YouTube, which is P2P BHAM. Okay? And please subscribe, hit the bell, and continue to uplift us as we continue to learn more and do more. It has been my pleasure once again. Until next week, you all have a magnificent evening. Thank you. Thank you for the hearts. I love them.